I'm John Strum, and this is Real Talk MS. It's February 28th, and we have a lot to talk about. Last week, I was in San Diego, California, where the America's Committee for Treatment and Research in Multiple Sclerosis convened their annual research conference, the ACTRIMS Forum. I'm still in the process of distilling the presentations that were made at the conference, and I'll be sharing those with you in an upcoming podcast episode. Today, I want to talk about one of the real highlights of the ACTRIMS Forum, the presentation of the Barancik Prize. This award is administered by the National MS Society, and it's given in recognition of exceptional innovation in MS research. This year marked the 10th anniversary of the Barancik Prize, and I had a rare and wonderful opportunity to have a series of one-on-one conversations with 6 Barancik Prize recipients. You'll be hearing those conversations soon as a special podcast series spotlighting this remarkable group of dedicated researchers. And you'll be hearing one of those conversations today. As I shared with you a couple of weeks ago when it was first announced, this year's recipient of the Barancik Prize is Dr. Ruth Ann Marrie, a clinician scientist at the University of Manitoba in Canada. During the ACTRIMS Forum, Dr. Marrie and I spent a few minutes talking about her groundbreaking research. In a moment, we'll hear my conversation with this year's recipient of the Barancik Prize for Innovation in MS Research, Dr. Ruth Ann Marrie. This year's recipient of the Barancik Prize for Innovation in MS Research is Dr. Ruth Ann Marrie. Dr. Marrie is a professor of medicine and community health sciences at the University of Manitoba in Canada and the director of the Multiple Sclerosis Clinic at Health Sciences Center, Winnipeg. Dr. Marrie's award recognizes her many groundbreaking contributions to our understanding of MS. In 2010, Dr. Marrie published the first report suggesting that other health conditions like diabetes, high blood pressure, heart disease, or high cholesterol could increase disease progression and disability in people living with MS. Since that initial study, Dr. Marrie and her team have shown that various comorbidities or other health conditions actually affect all aspects of MS, including time to diagnosis, severity of disability at diagnosis, the use of healthcare, relapse rates, and mortality. In 2012, Dr. Marrie published a landmark paper showing that people with MS increased their use of healthcare through visits to the doctor during the 5 years before the first symptoms of MS occurred. Dr. Marrie's work in this area has led to the recognition of the prodromal phase of MS, which is something we've discussed on previous episodes of the podcast. And as researchers learn more about the MS prodrome, it could lead to a time when early intervention, before even the first typical symptom of MS has occurred, could lead to preventing MS from ever developing. Dr. Marrie is a co-author of the Pathways to Cures Research Roadmap. She serves as the vice chair of the International Progressive MS Alliance Scientific Steering Committee, as well as the scientific director of the NARCOMS Registry. First, congratulations on being named this year's winner of a very well-deserved award, and welcome to the podcast, Dr. Marrie.
Thanks so much for having me.
So what was it that first got you interested in MS research?
Well, I was really fortunate when I was a neurology resident at McGill to have a program that expected us to do 6 months of research. And unlike some of my colleagues who wanted to go and look at MRIs for hours on end or work in a lab with pipettes and things, that wasn't really my interest. When I had been a medical student, I'd had the opportunity to work in an area of epidemiology. So just trying to understand risk factors for disease, who gets it and how often. So I essentially found the only neuroepidemiologist at the time at McGill who agreed to take me on as a student. And she had a couple of choices of projects. And the one on MS sounded more interesting to me. It was about Epstein-Barr virus, which is a popular topic these days. And so as part of that, I really had to do a lot of reading to make sure I could really execute the project and really take ownership of it. And realized in the course of that I was quite interested in what I was learning about. And I hadn't had much exposure to MS at that point because I was doing mostly inpatient care. And so got permission to spend half a day a week in the multiple sclerosis clinic throughout that rotation. And by the end of that time, the clinical exposure and the research exposure really cemented for me that that's where I wanted to be.
As I mentioned a moment ago, one of the areas that your research is focused on is how other health conditions called comorbidities impact virtually every aspect of MS. As people age, it becomes more and more likely that they'll develop some other health conditions, so it's not an uncommon situation. I have a two-part question here. Do comorbidities themselves worsen MS in an individual? And does having other health conditions, these comorbidities, make treating MS more complicated?
Yeah, so I think those are both important questions that we deal with in the clinic every day. And so what we have found, and now others have replicated, is that having other health conditions is associated with MS being worse. And we can think about that from a few perspectives. One is relapses. So we see higher relapse rates when people have more coexisting conditions, in particular if they have high cholesterol. We often notice a lot when people have difficulty with their mobility. And so that's something where we see progression of those kinds of impairments is faster when people have more physical comorbid conditions, but also when they have depression and anxiety. We see more changes on MRI as well with health conditions. And then when we think about cognition, so our ability to think and remember, which is really important to people with MS, we also know that those coexisting conditions are associated with worsening in that way. And so it gets more complicated still when we start to think about treatment. Why? Well, I need to be thinking about the MS-specific treatment. We need to make sure that those coexisting conditions are taken care of. But also because some of our therapies may increase the risk of developing coexisting conditions, and because some of the medications that we use to treat the coexisting conditions are things that don't mix well with our disease-modifying therapies. And so that means that you need to be thinking about the choice of MS-specific therapies in the context of all of the other issues that person with MS has.
I've always had a particular interest in your research in identifying and better understanding the prodromal phase of MS. I'm hoping you'll explain to our listeners what the prodromal phase of MS is and how being able to identify it in someone might lead to preventing MS from developing.
Sure. So I think we can start with an example that might be more common for people to see. So many of us know somebody with migraine headaches because it's so common in the general population. And so a lot of people with migraine, before they get that really blinding pain in their head and the sensitivity to the lights and sound, have some nonspecific symptoms that constitute their prodrome, like a change in appetite or thirst or just being kind of grumpy and tired. But it's kind of a warning that the headache is coming. So with multiple sclerosis, we now recognize that before people have those first really specific symptoms we recognize with MS, like the visual loss and the eye pain that represents optic neuritis, is that there are non-specific symptoms that precede that. So we are beginning to see that it's things like, fatigue and perhaps depression, anxiety, and those kinds of pieces that precede it. And the real value in that is that's maybe our opportunity to intervene and do something to prevent those more problematic and highly typical specific symptoms forever developing. So thinking about it as a prevention exercise so that we stop it, and then maybe you don't have to go through all the disease-modifying therapies and all the consequences that we currently recognize as having MS. So I think it's a golden opportunity. I
agree. You're the vice chair of the International Progressive MS Alliance Scientific Steering Committee, as well as a co-author of the Pathways to Cures Research Roadmap. Both of these really important, significant initiatives leverage scientific collaboration on a global level. Why is that important in moving MS research forward?
Well, MS is complicated. I think we all know that. It may seem obvious, but when you have a complicated problem, you really want all the smartest people in the room working together. What happens if you don't? Well, maybe you have 4 people working on the same piece of the pie, right? The same part of the project. And maybe they're all stumbling along more slowly because they're all figuring things out from scratch. Well, if we work together, then maybe what we can do is have one person working on one piece and the other people can spread out and work out on the other missing pieces. And I can share what I've learned so that you can do it better and can build on what I've done instead of starting from scratch. And so that allows us to move ahead much more quickly. And we need to do that because there are so many complexities. We really need the most rigorous science from wherever it is in the world to move forward as quickly as possible so we can get to those pathways and to the actual cures that we want in each of those areas.
The very first time that you and I talked was when the work that you led in the prevalence of MS in the U.S. was published. Now there's been additional work done on kind of fine-tuning what we know about the prevalence of MS in the United States. I'm hoping you can first explain the methodology behind this study and then share some of the more nuanced, detailed findings.
Sure. So first, when we're thinking about prevalence of MS, really what we're talking about is counting the number of people with MS in the population. So when we think about per capita numbers, right? So then the question is, how do we do that? So old-fashioned ways, when you have small pieces of the world to look at, like a county, for example, are to knock on the door and ask, do a survey, or look at medical records from everybody in a region. It's not a realistic strategy for a large country like the United States. But what happens? Most people go to doctors and go to hospitals, and there are records that are gathered as a part of those encounters. And so researchers can access those kinds of data, which are called administrative or health claims data. So then there's the next problem of the fact that the United States does not have a single health system. So people may be getting health care through the Veterans Health Administration, or they might be getting it paid for through Medicare or Medicaid or through a commercial health organization. So what we thought about was that people must exist, for the most part, in at least one of those pools. So what we could do is develop a strategy to identify people with MS in each of those pools. So first we developed essentially an algorithm. So how many times did people with MS have to get health care where somebody wrote a diagnosis of MS as part of their billing to the health insurer before we could be confident they had MS. So we did that work in Veterans Health Administration, Kaiser Permanente in Canada, and showed that actually the same rule worked everywhere, which made us feel more confident about it. So you need to have sort of at least 3 of those healthcare contacts. And then we could apply it to a series of data sets. So we could identify all the people with MS within the Veterans Health Administration and all the people within Medicare and all the people within Medicaid, and then within a couple of different commercial health organizations. So then what we needed to do is figure out, well, what percentage of the American population gets their care within the VA or Medicare or Medicaid. So I could then take that percentage and multiply it by the number of people in that particular insurance pool. And I can add them all up now. And then that allows me to get a total number of people with MS in the United States. And then I could go back and say, well, what's the population of the United States? And I can put one number on top of the other, and now I can come up with that per capita number. Once you've got that, you can use that same approach to figure out how the numbers differ by whether you're male or female or where you live in a particular state or by race or ethnicity. So it gives us lots of opportunity to try and really understand prevalence better.
Can you share any insights into what some of the more recent calculations told us?
Sure. So we've been really trying to understand more in particular about race and ethnicity in terms of the prevalence of MS. So there's a lot of historical views about who was at most risk of getting multiple sclerosis. So really often people thought of people who self-identify as white and of European ancestry. And people really didn't think that MS was very common in people who identified as, African American, Black. And so the work that we've done has told us that actually people who identify as African American or Black are almost as likely as people who identify as white to have MS. And so that's a really big shift from thinking it's uncommon to thinking it's just as common. And then when we looked at Hispanic ethnicity, we saw that the likelihood of MS was lower in people who identified as Hispanic, but it's not low when you consider the world region that we live in, where we have a pretty high prevalence. And so these are really important things to help us think differently when people come in with neurologic symptoms, and they might not be in the racial or ethnic group that we traditionally have thought about as being at risk. So it's really important not to miss people because we have those kind of preconceived notions.
Those preconceived notions too often historically have become barriers to access to care, where people either spend years not being able to get a diagnosis, or even when they get a diagnosis are told, well, that can't be right because MS only affects white people. So this is really important information for clinicians to have everywhere.
I agree. I mean, I think this is, whenever somebody doesn't come in with kind of the traditional appearance of whatever disease, this is a challenge that they face. And so the diagnostic delays, of course, we know affect long-term outcomes in multiple sclerosis. And so, I think, an important piece is that we need to make sure that clinicians at all stages get this information. So it's not just when you get to the MS specialist, it's the person who's doing the referral to the neurologist in the first place. It's the person themselves thinking that maybe they have a condition that might be MS and advocating. And so going to their doctor and then getting their primary care doctor to do the referral and sort of moving down the line. So we have a lot of people who need to know this information. Easier to get it out to the neurologist, but we need all of the people who are involved in that healthcare pathway to be aware.
Well, Dr. Ruth Ann Marrie, thank you for all you do to improve the lives of people living with MS. Congratulations once again on being named this year's recipient of the Barancik Prize for Innovation in MS Research. And thanks so much for talking with me today.
Thanks for having me.
If you're a regular listener, you've probably heard me say that the things that people affected by MS want the most, things like access to quality health care, affordable prescription medications, and funding for MS research, are, to a large extent, all functions of public policy. The people who decide whether we get those things are our elected officials at both the state and federal level. That's why advocacy is a priority for me. My own experience has shown me that advocating on behalf of your own interests is one of the most empowering things that a person can do. And next week, the National MS Society's Public Policy Conference gets underway in Washington, D.C. Joining me in a moment to talk about the importance of this year's conference is the National MS Society's Executive Vice President for Advocacy and Healthcare Access, Barry Talenti. The National MS Society's Public Policy Conference takes place next week in Washington, D.C., and as an MS activist, this is something I look forward to every year. Joining me to talk about what we can expect at this year's Public Policy Conference is the MS Society's Executive Vice President for Advocacy and Healthcare Access, and one of my favorite guests on the podcast, Barry Talenti. Welcome back, Barry.
Well, thanks, John. I'm so glad to be back. I love having this time to talk with you about our advocacy efforts.
To start us off, I know we talked about this a year ago, but for the benefit of everyone who started listening to the podcast since then, can you tell us a little bit about what the Public Policy Conference is and why it's so important?
Yeah, I'd love to. The Public Policy Conference is an opportunity for MS activists around the country to convene in Washington, D.C. to learn, to connect, to grow in their advocacy skills, and, just as important as all of those things, to actually go to Capitol Hill and meet with their elected officials to urge change on issues that are of priority importance to people with MS. So we know that the Public Policy Conference is a single point in time, but the people who come are really committed to engaging in advocacy year round and keeping that momentum going even after they leave Capitol Hill.
You know, as someone who is affected by MS, for me, the idea and the value of advocacy is sort of deeply embedded. I'm hoping you'll maybe talk about what makes advocacy important to people affected by MS.
Well, as I think about it, advocacy is life-changing. And there's a few ways that it does that. But, the first, we look at our advocacy work as ways to create change on a systemic level for people with MS. So, MS navigators are really great at supporting people individually through their journey with MS and getting them whatever they may need. But oftentimes those resources don't exist or could be improved. And that's where advocacy comes in. So advocacy is that one shot at really making that change happen for everyone in our country at the federal level. And so we really look at it as a way that, if there's laws that aren't working, advocacy is the way to change them. If there's gaps in resources for people with MS, advocacy is the way to create those resources and make it happen. And so that's one way that advocacy is life-changing, by literally making sure that people can get the resources that they need through their journey with MS. But the second way is just the act of engaging in advocacy is life-changing for so many people. It's that way to take control, to raise your voice, to amplify the message of people in the MS community alongside others, and be really loud and proud and clear about what it is people with MS need. And through the action of doing that, MS activists often tell us that they feel like their lives have been changed and they're taking control back in the face of MS.
I always try to make it a point of letting folks know that our advocacy efforts produce real results for everyone affected by MS. So I'm hoping you'll take a victory lap here and talk about some of our recent advocacy wins.
Absolutely. So, the work of MS activists has really been so tremendous and inspiring over the past few years. And we have a lot of really important wins to point to. Throughout the COVID pandemic, MS activists really weighed in on a lot of the different relief packages that made their way through Congress and made sure that there's resources created in there for people with MS, which, range from making sure that vaccines for COVID and treatments were available to everyone and at low or no cost, that telehealth was expanded and available to people throughout the pandemic. So people with MS could get the care they needed without having to worry about leaving their homes or going into a medical facility, which was, the worst place to be during the heat of the pandemic. So those are a couple of things. But most recently as well, we saw the passage and the signing of the Inflation Reduction Act, which included really key provisions around medication pricing and access to medications, particularly for people in the Medicare prescription drug benefit, which is people who are 65 and older or people who get on Medicare because of their disability status. And so the IRA really is not a culmination because we're still working, but it brought together a number of key provisions that we've been working on for a long time related to access to medications. And so now we have some provisions in law that range from things like medication prices can't increase above a certain percentage each year or above the rate of inflation, or the prescription drug manufacturer has to sort of provide money back to the government. In just a year or two, we'll see that the out-of-pocket cap for people in the Medicare prescription drug benefit will be at $2,000. Today, people with MS often are at $7,000 out of pocket just for their MS disease modifying treatment. So that $2,000 cap will be tremendously helpful and life-changing for many people with MS. And we're also looking at the ability to spread those out-of-pocket caps, those out-of-pocket costs throughout the year in an effort that's called smoothing, so that it's not $2,000 in January and February, but more equal amounts through the year that will be more manageable for people in their household budget and their daily lives.
Each year, activists at the Public Policy Conference focus on a couple of issues that affect people living with MS. What are the issues that MS activists will be focusing on this year?
Yeah, so this year we're going to be focused on appropriations specific to a couple of MS-specific programs. And so the first of those we've talked about quite a bit before, and it's the funding for the MS research program in the Department of Defense. So this has to be an annual appropriation that Congress does. And currently, Congress is appropriating $20 million a year for this program. We're going to be asking for $22 million, so a slight increase to keep up with inflation and ensure consistent funding for MS research. This is the only MS-specific research funding that happens through the federal government. And people from the MS community and the National MS Society staff sit on many of the program review committees within this program. And so there's a lot of consistency and complementary efforts that happen. And so the funding for this really is additive and a little bit different than you'd see in other research funding programs. We're also in our appropriations looking at increased funding for the MS Veterans Affairs Centers of Excellence, so the MSVA Centers of Excellence. So these centers right now sort of receive less funding than other centers of excellence in other disease states. Right now, there's centers have a total budget of about $2.5 million, an amount that's really been stagnant since about 2003. And so we're supporting increasing that funding level to $7.5 million for fiscal year 2024. And that will let the MS Centers of Excellence do more activities to support veterans with MS, including, hiring and replacing staff, engaging in research and the dissemination of information and resources. And so really a critical role for the MS community and something that we're excited to be able to support this year for that increased funding. So that's the appropriations bucket. The second priority issue that we'll be taking during our public policy conference this year is air travel accessibility. So a little bit different for us, but we have a key moment in time this year where the FAA is up for reauthorization. So that means that Congress has to look at the legislation that oversees air travel in our country and take a look at it and reauthorize it to ensure that that agency stays funded. So that provides a key opportunity for us to really raise a lot of the challenges that people with MS and others with mobility and accessibility issues face when they're trying to undertake air travel. We hear from people with MS quite often that either they're not traveling by air, they're super concerned and worried about it. It's a very unpleasant experience. Many of us think air travel is an unpleasant experience, but it's even more so for people with accessibility challenges and who rely on mobility equipment. So one of our partners in this effort, the Paralyzed Veterans of America, has done surveys across the last few years and really works on this issue. And 14,000 wheelchairs were damaged, delayed, or lost in 2019 and 2020. So that's obviously not okay. And we're, again, at that point in time with the FAA reauthorization where we can raise awareness of that and look at what we can put into place in the law to ease air travel for people.
As you just mentioned, while MS research is funded at the federal level through the Department of Defense MS Research Program, a lot of the issues that impact people affected by MS are actually decided by each state. So MS activists are involved in advocacy work on both the federal and state level. Can you talk about the kinds of activities that take place at the state level?
We have between 20 and 30 state action days that also happen each year around the country to meet similar goals as the public policy conference, to be a convening activity, to bring people together, to engage, to learn, and to move our priority issues forward at the state level. So many of those days are happening in person through 2023. Some are happening virtually, but they all provide that opportunity to meet other activists, to learn from each other, to connect, and to take our message to elected officials in the states. So state legislation is a great opportunity to, one, create change, but also to try some new or innovative ideas, because it can be easier to move those things through at state level than sort of the large congressional landscape that we're in. And a lot of our healthcare related priorities and legislation happen at the state level. So we work on things from common sense step therapy to timely and accessible prior authorization, prescription drug affordability boards to get at the access to medications and drug pricing issues that we've talked about before. We also can see a lot of issues related to long-term care or some disability rights things as well. So lots of opportunities and engagement at the state level.
As you alluded to earlier, I found that advocating on behalf of your own interests is one of the most empowering things that someone can do. So I always encourage my listeners to get involved in advocacy. How can someone sign up to be an MS activist?
Well, our goal is to make it incredibly easy for anyone to become an MS activist. And there's lots of different ways to engage as an MS activist as well. So people shouldn't be nervous or scared that they may have to go meet with an elected official that they're not comfortable about, or really understand all the policy nuances and legislative text. Our staff is there to help support people through that and to do that level of detail. We want people with MS to get comfortable in raising their voices and telling elected officials what it is they need. And so people can sign up to be an MS activist through the National MS Society website under the Get Involved section, or they can follow our advocacy efforts on Twitter at MS Activist, or they can check out John's show notes where he'll leave some tips on how to do that. I'm stealing John's thunder a little bit there.
Reading my mind.
Yeah.
Barry, I want to thank you and your entire team for all you guys do in guiding our advocacy efforts so that we continue seeing the kinds of legislative outcomes that deliver real benefits to people affected by MS. That's going to wrap up this episode of Real Talk MS. Real Talk MS is powered by the National MS Society. And you can share this episode of the podcast by letting your friends or family members know that all they have to do is point their web browser at realtalkms.com/287. You'll find that link in today's show notes so you can easily copy and paste it right into an email or a text. And if you have a minute, I hope you'll visit the Apple App Store or the Google Play Store and download the free Real Talk MS app for your iOS or Android smartphone or tablet. It's the best way for us to stay connected. The app will automatically download the latest episode of Real Talk MS. You'll be able to access any of our past episodes. You'll be able to save your favorite episodes. And it's a great way for me to share bonus content with you. The app is free, so I hope you'll download it today. I'm John Strum. Thanks for listening. Stay safe and make healthy choices.